Hi, I'm Dr. Sarah Ballister, board certified in periodontics and dental implant surgery, and I want to talk to you about jawbone health. A lot of times we just think about our teeth and we're always checking and worried about cavities, but sometimes we forget that the bone that holds in our teeth is as important as the teeth themselves, and without that bone, we don't have anything to hold in our teeth. When a patient gets gum disease, what happens is that supporting bone structure can get eaten away, leading to tooth loosening and tooth loss. And it's very difficult to get that bone back. Not impossible, but very difficult. So it's best to treat gum disease early and comprehensively to make sure that you can maintain and preserve your natural teeth for a lifetime. There are lots of different things that can cause patients to lose jawbone or the bone that supports our teeth. One of the main things that causes jawbone breakdown and destruction is gum disease. Another thing that we don't think about is when we lose our teeth or have a tooth pulled, that area can shrink down and the jawbone can shrink. When there isn't a tooth in the area, the jawbone can shrink, and it can make it more difficult to place dental implants in our patients. So what we really recommend is getting evaluated for jawbone preservation or bone grafting at the time of tooth extraction if you're planning on having a dental implant to replace that tooth that's being pulled. At Advanced Periodontics and Dental Implant Center in Connecticut, we're always thinking long-term for our patients. It's really important to think long-term for your patients. When you have a patient who has a hopeless tooth that needs to be pulled, the problem at hand is getting that tooth out, removing the infection, and getting your patient comfortable. But a lot of times you have to think a few steps ahead. If you're interested in having a dental implant placed in that area, it's important to have a provider who sees that path ahead for you and is planning for you. When you take a tooth out, it can leave a big hole or gap in your jawbone. And many times once the tooth is removed, we should be placing bone graft material to prep that area and preserve the jawbone for a dental implant in the future. Dental implants are a great option to replace a missing tooth, but there's lots of factors that contribute to whether or not you're a candidate for dental implants. Obviously, you have to be healthy enough to undergo dental treatment or the dental implant procedure. But another major factor is your jawbone. So you want to make sure that you're doing everything you can when you have your tooth removed to prepare the jawbone and prepare that area for dental implant placement in the future. One way that we can do that is when the tooth is removed, we can place bone graft material in that area. That grafting material isn't like a foreign body. It stays and your own bone actually grows into it. So it preserves your jawbone and just grows more natural bone in the area. It's a great way to preserve jawbone for dental implant. If you've been told in the past that you're not a candidate for dental implant surgery due to lack of jawbone, I'm here to tell you that techniques have changed and there's lots of different options available. Where in the past you may not have been a candidate or there might not have been a procedure available to regrow jawbone in the area prior to dental implant placement, there are procedures like that available now. I highly recommend coming in for a consultation for dental implants if you'd like to have fixed teeth that don't come in and out to replace your missing teeth. Things have changed. There's advanced technology. You've got nothing to lose and everything to gain when you come in for a consultation. Dentistry's come a long way. Before, the only solution when you lost your teeth were dentures or plates. Now we're able to place dental implants to snap into those plates. We're also able to use dental implants to replace a single missing tooth rather than having a bridge or something that comes in and out. And with the progress comes even more advancements. Patients who in the past were told they weren't a candidate for dental implant surgery or fixed dentures may be now. I highly encourage you to come for an evaluation, even if you were told you weren't a candidate in the past, because there are advancements in implant placement technique as well as bone grafting. There's also laser-assisted implant placement available. I highly encourage you to come in for a consultation. You've got nothing to lose and everything to gain. And by everything, I mean your smile.